So welcome to our town hall. We will be starting at 2 o'clock. Okay, it's 2 o'clock, so good afternoon, everyone. Welcome to our town hall with the Developmental Disabilities Services Division on COVID-19 emergency supports for family caregivers. I'm Karen Price, co-director of family support at the Vermont Family Network and your host today. Next. So Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. Next. Today's meeting is being recorded and will be saved on the Vermont Family Network website and YouTube channel. Everyone who registered for today's webinar will also receive a follow-up email with a link to this recording. Next. All participants are muted. You can ask questions throughout the presentation, but first the presenters will review their prepared slides, which also addresses questions that were submitted to us in advance. After that, as time permits, they will do their best to answer other questions. Please use the chat function at the bottom of your screen to ask your questions. I'll keep an eye on those, and when it's time for Q&A, I'll read each question out loud. If you want to ask your questions out loud at that point, please use the raise hand function, which is also at the bottom of your screen, and I will unmute you. And now I would like to welcome our presenters.
Hi, my name is Claire McFadden. I work for the Department of Disabilities, Aging, and Independent Living, and we are providing some updated information around emergency supports for family caregivers for what we call the first quarter of the fiscal year, which is July 1st through the end of September. Next slide. So we also have on the line, besides myself, Selena Hickman, who's the Director of Developmental Disability Services Division, we might be able to unmute her if we have some specific questions for her, and Amy Roth, who's the Assistant Director of Developmental Disability Services Division. Next. So, why are we here today? Well, when the COVID emergency started and the state of emergency was declared back in March of this year, we made some flexibilities and emergency supports available to family caregivers. And when we did that, we had set a timeline from the time of the declaration of the state of emergency through the end of June, which is the end of the state's fiscal year. So generally, the state operates all its programs and services based on a fiscal year because that's when the funding for all the services is determined. And so I'm going to turn off my video because I think it may improve the sound quality. So you won't be able to see me, you're just going to hear my voice. I hope that helps improve the sound quality. So again, we made some emergency supports available to family caregivers due to the state of emergency. There were urgent requests from families at the time, and the federal government allowed us to adjust some of our usual rules in order to address the needs of people during the pandemic. So what's changed is starting with the new fiscal year, there are some changes that are impacting what we're able to offer around emergency supports for family members. Next, please. So a couple of things that have changed. The governor has continued to update his orders around our response to the COVID emergency, and he's allowed for a gradual reopening of the economy and businesses due to the low rate of COVID in Vermont. So things are starting to open up. Another issue is that this year is a very unusual year due to the pandemic, in that the legislature is revisiting the state budget for the next fiscal year. So they only had authorization of funding for the first quarter, which is at the end of September this year. And then the legislature is going to be reconvening and approving a final budget for the rest of the fiscal year. So basically departments have said, okay, so my sound is really low, not sure what to do. I'll try speaking up and see if that's of assistance. So the legislature is going to be approving their final budget as the year goes through. And we will have more information about the budget after that happens, which is happening, it's just restarting now. And so we'll be awaiting, our departments will be waiting for our final budgets to make decisions. Let's see. All right, I'm trying to make my sound as loud as I can. If somebody can tell me if that sounds okay, that would be good. So some other things that have changed is that agencies who are providing services have started to resume some of the services. All of our agencies are doing that. And for those people who hire their own workers, some families have started having workers provide services again. Next slide. Okay, thank you for letting me know this sounds better now. Another thing that has changed is that the division did put out some guidance and tools for teams to consider whether it's safe for people to resume services face-to-face and participate in activities in the community. On the guidance document sent out last week regarding the emergency supports, which I think everybody who's on the call received, there's a link to those tools. And you know, if you haven't already started utilizing them or having discussions with your provider agency, those would be very good tools for you to utilize in trying to make decisions about what's safe to resume. So another thing that's changed is that initially the department allowed providers to continue to receive payments for services, even though the services may not have been being delivered, in order to stabilize our provider network for the future. So we got permission to allow for that in order to ensure that the provider network remains there and people have staff who are able to continue to provide services once it's safe to do so. However, now there are different funding mechanisms through the federal government, and it's through the Corona Relief Funds. And those funds are available to help stabilize providers and enable them to cover some costs related to lost income or additional expenses they may have related to addressing the pandemic. So agencies have a different way of receiving financial relief, aside from the department allowing them to continue to receive payments from the department through Medicaid. So we are shifting our instructions to providers regarding what they need to do. So starting in September, agencies won't be able to continue to bill for services that aren't being delivered, and they'll have to suspend the billing for that. And they would only be able to resume that once they resume providing services. And they instead can get their losses covered through this Corona Relief Fund. And the final thing that's changed is in March to June of this year, the department offered additional funding to providers so that they could increase the allocations that families could receive under the Family Managed Respite Program, but that is no longer available. This fiscal year, we don't have those funds available. So essentially the Family Managed Respite Program, the allocations that will go to families will go back to the usual way and amounts that those allocations are made for families to use for respite. Next slide, please. So who can get this emergency support? So this is available to anyone who receives services through the Developmental Disability Services system. So people who get their services from designated agencies or specialized services agencies, or people who are self and family managing with the assistance of transition too. Next slide, please. So we have 3 options available. And the first one is for people who have home and community-based services, and we're allowing people to convert their family managed funds. The second option, which I'm going to go into more detail on, is that it's going to be this is an optional option. That doesn't make sense. And it's going to be at the discretion of the provider agencies, and I'll go into more detail about why that is in a few minutes. And the third option is the priority use for one-time funds that we provide to agencies that they make available to people in services. Next. So I'm going to talk about the first option, which is the conversion of family managed funds. Next. So what is this? This is, as we had done in the last quarter of the fiscal year from March to June. A lot of people will be familiar with this from the last time, and things are essentially the same. But if families are unable to hire workers due to the pandemic, either because it's not safe to have workers or because workers aren't available due to the COVID, and there's a loss of support of those support workers, a payment can be made to family caregivers in the form of a difficulty of care payment. And the purpose of the payment is to help for those family caregivers to help maintain the health and safety of the individual that they're supporting in their home. And so the question is, what do family caregivers need to do? So we're expecting that if possible, that the family caregivers can help support the continuation of working on the goals that are in the person's current ISA. And we realize that that may or may not be possible. But if it's not possible, then the family caregiver should be prepared to talk to their case manager and report back to them around how they're helping to maintain the health and safety of the person that they're supporting. So, we're also hoping that families and agencies have ongoing conversations about what people's needs are and any adjustments that need to be occurring. So maintaining that good open dialogue between the families and the case managers at agencies. Next. So this is a description of who can receive the difficulty of care payments. And this language is exactly what it says in the document that was sent out ahead of the of this webinar. And so a person has to have a home and community-based services budget. Sometimes that you may be familiar with the term waiver. We don't call it that anymore, but that's what it used to be called. So people who have a budget like that are you have to have that. The person has to be living in the home of the family caregiver. And the reason for that is because difficulty of care payments are only available to caregivers who are providing support in their own home. That's that is a federal rule. The third requirement is that the family caregiver is providing additional care beyond what they typically are providing. And this is due to the loss of available workers. And again, the unavailability of workers, that there should be a team decision regarding participating in services. And if participating poses a risk to people's health and safety, then that would be a reason for not having workers providing supports. And then the final bullet we have here is that there's unused respite or other family managed funds. Again, the funds that are in a person's budget that are paid out basically through payroll or non-payroll expenses through ERIS. So it's the services that aren't associated with agency hired staff. And it's regarding the funds, the unspent funds that are in a person's budget from the beginning of July through September. And again, it could be, people could anticipate that there's not going to be any services during that period of time and seek to get a reimbursement, or wait until the end of the period and see what's left over. But it's basically what is not spent. And a person could employ workers, but maybe you don't have the full contingent of workers, and so that you could be using some of the budget to pay workers, but then also have leftover money because you're not getting the full amount of services, and both of those are acceptable. So the final caveat is that generally if it's been determined that it's reasonably safe and workers are available, then an unpaid family caregiver would not be able to get the difficulty of care stipend. And again, these discussions are going to be happening between the team members and the family and the agency. Next slide. So, how much money is available? So, a person could convert up to $5,000 or 1/4 of their annual allocation for family managed direct services, whichever is less. And so it's again, just for this first quarter of the fiscal year ending in September. And there's an example here. So a person may have, let's say, $4,000 in their annual budget, $4,000 in respite and $12,000 in family managed community supports. So their total budget that they manage through ARIS is $16,000. So 1/4 of that is $4,000. So that's the total amount that could potentially be converted. So out of that 4,000, what would be available to convert is anything that's unused. So if workers had been hired or there were other non-payroll expenses where the funds had been used, then it would be the balance of the dollars that were remaining. Next. So when is the money available? And again, the money is currently in people's budgets. You should know what your annual allocation is for your services and be able to calculate that. And you also get the ARIS reports on a regular basis. So should have a sense of how much money is left over and that's unspent. But the requests for payments are made to ARIS by the agencies, and we want those requests submitted by November 7th of this year. So the end of the first quarter is September 30th. And that deadline of November 7th is 2 pay periods after that, the end of September ends. And so it should give you enough time to figure out what it is that's left over and that could be converted. And so you'll want to be working with your agencies ahead of time so that there's plenty of time to make sure that the discussions can happen and that the requests are, that the agency has the information to make the requests in a timely fashion so that they can get those in before the deadline. And one thing, I'm not sure I made this clear, but the reason that we're only talking about the first quarter of the year is because the state budget, again, I mentioned this earlier, is we are only authorized, Dale is only authorized to spend money for the first quarter of the year. Therefore, we can only extend the authorization for these payments through the first quarter of the year. Once the state budget is finalized for the rest of the fiscal year, the department will go back and make some additional decisions about what's going to happen for the remaining 3/4 of the year and what might be available to families. So in order to get this funding, you need to talk to your service coordinator at your agency, or if you're through Transition 2, you speak to your advisor there and find out if this payment option is available to you, and then the agency will submit the request on your behalf. Whoops, sorry about that. There's always working at home interruptions. Sorry about that. Next slide, please. Okay, so option 2 is a flexible COVID-19 crisis stipend. Next. Okay, so I want to emphasize that this option is optional at agency's discretion, and I'll talk about why that is in a minute. These are also difficulty of care payments that can be made to family caregivers. And again, it's at the agency's discretion. And it's essentially for the same purpose. It's a payment to family caregivers to help maintain the health and safety of people who are in services related to not having support workers because of COVID. And again, the same thing for these payments. If a family caregiver is going to receive one of these payments, we're expecting that the person's ISA goals are going to continue to be worked on, if possible. And if not, then agencies, the family caregiver should be talking to the case managers at their agencies about how they're helping to maintain their health and safety. Next. Okay, so here's the reason that these payments are optional. And it's that, again, the agencies will decide whether they can offer these payments or not. So essentially what's happened is the federal government made some coronavirus relief funds available to states to help address the impact of the pandemic. One of the uses of those funds are to help to stabilize the healthcare providers, which does include our designated and specialized services agencies providing developmental services. And it's to assist them around any losses, financial losses, or additional costs that they have related to addressing the pandemic. The issue is that the total amount that's available to the state is limited, and providers can apply to get reimbursed for these funds, but because it's a limited amount of funding, and it applies to not just our developmental services agencies, but all healthcare providers in the state of Vermont, there's no guarantee that what they ask for will end up getting reimbursed, or that they will get reimbursed at for the amount that they ask. So agencies essentially, what they have to do is they would have to essentially take a risk and outlay money from their own sources, and then request reimbursement after the quarter is over. So they would pay out the money and then submit a request for reimbursement. And there's no guarantee that they'll get it. And so, you know, some agencies may be would take that risk. Some agencies may in a financial position to take such a risk. They may not have funds available to do this. And so for that reason, the state requiring that agency offer this option, but it is an option should choose available. and that available to other people. The reimbursement for these difficulty of care payments is something that's been identified as a potential cost that could be reimbursed with these funds. Next slide. So again, the who can get this funding is very similar to option 1. The person has to have a home and community-based services budget. The individual is living in the home of the family caregiver, and the caregiver is providing it extra care because of the loss of some of their typical services that they receive from the agency. So this specific option is when people have lost agency managed services. The first option was when someone had a loss of services that were family managed. So again, it's when services have been reduced because of the unavailability of workers, or a team decision that participating would be a health and safety risk. And as I said previously, the agency would have to be able to bear the cost of this difficulty of care stipend if the corona relief funds are not awarded, because they may or may not get reimbursed at the rate that they request. And again, these payments to unpaid family caregivers would not be available if it was determined that it was reasonably safe and workers were available. So essentially, it's like if services can be provided and there's an agreement that it's safe, not really an option to just for a family to say, I'd rather take the money. These funds are for the provision of service, and if that service can be provided, it should be provided. So for this option, it's a one-time payment of up to $2,000. And again, the maximum
Claire, I think you're, you seem to have cut out.
Yes, I think she got disconnected.
Okay, this is Amy Roth. I can.
I'm back. Can you hear me now? No.
Claire, you're going in and out quite a bit.
Oh, darn.
Want me to pick things up at the moment?
Yeah.
Right?
Yeah, go ahead.
Okay. Hi, everybody.
Sorry about that.
It's okay. This is Amy Roth. So we're on this last slide about the optional payment. And so it is a one-time payment of up to $2,000. And this doesn't constitute a guarantee. The agencies would have a discussion with you and your family to evaluate the level of typical supports versus what's being provided by the family caregiver in order to determine the appropriate amount. So this is going to be a discussion, you know, between you and the agency. And again, this payment, we are not mandating that the provider agencies offer this because they would be incurring a risk in terms of future reimbursement for the dollars. Next slide, please. So when is this money available? So again, this payment is available from July 1st through September 30th. And agencies would need to provide the stipend prior to September 30th of 2020 because they have to record, the agencies have to record that information about what, that it's been paid out prior to that time when they, later when they go to request reimbursement. And again, you would need to talk to your service coordinator at your designated agency or specialized service agency to assess if this payment is available. And this option is not available to people who are involved with Transition 2, who self and family manage their entire budget. Next slide, please. Okay, so this is the third option, and that is flexible use of one-time funds. Next slide. So one-time funds are dollars that are received annually by our provider agencies for specific purposes to assist people who may be in crisis or to address some kind of health and safety need that's outside of the boundaries of what people already have in their budgets. There's a whole list in our system of care plan about how one-time funds can be used. And here's, it's prioritized often for flexible family funding, which some of you may have accessed previously before your family member received home and community-based services, or to address a person's short-term health, safety, or public safety or crisis need. And so anyone who's eligible for developmental disability services may be able to access this funding, would have to discuss that with their provider agency or with Transition 2. Next slide, please. And this is the amount of funding is based on the specific needs of the person and has to meet the guidance that we have already for flexible family funding or one-time funding. And you would need to speak with your service coordinator to find out if this option is available for you. Next slide. Okay, so we're now going to review some of the questions that were sent to us ahead of time. And I think in answering, I've been looking at the questions that are popping up from folks that are participating today, and I'm seeing that there's, I think, some repetition in the questions. So hopefully we will answer a good number of your questions, and then we will have some time for folks to ask additional questions. We're also, if we run out of time or if you have to step out of this webinar, we are intending to create a document with all the answers to your questions, and that'll be posted on our Dale and on our Vermont Family Network website. There might be some questions we have to research or discuss and get back to you, and we'll update that Q&A document. Okay, next slide, please. Okay, I'm not sure if I'm supposed to be doing this one or just moving on to your questions. Why don't we just start working with the questions? Let's go to the next slide. Okay, what do we need to do?
Yeah, these are all questions that were sent ahead.
Beautiful, okay, thanks. What do we need to do and when do we need to do it to receive the stipend? So families should work with their provider agency. That's either your designated agency or your SSA or your advisor from Transition 2 to determine which option pertains to your circumstance. Your agency will provide assistance, and the funds are available through September 30th of 2020. So families should absolutely contact your agency by early September to make sure there's enough time to process these payments. And on to the next one. Okay, so for the stipend payments, who is the employer and employee? So these are being considered in the two stipends that we discussed for option 1 and option 2 may be considered tax-free difficulty of care payments. And I did see that there was a question that popped up from someone about that. So we have determined that these are tax-free difficulty of care payments. So there is no employer or employee. They are not considered income for the purpose of federal taxes. So I hope that helps to clarify, because we know that that has been a question for a lot of folks. Next, please. How do these payments impact parents' benefits, such as unemployment, SSI, fuel assistance, reach up, food stamps, and other types of benefits? So Dale can't answer that question because there are so many different programs and each one has its own rules regarding what is considered income. So families will have to talk to those programs to get answers to those questions. Perhaps your service coordinator, case manager at the agency can help you figure out who is the best person to contact if you don't have a contact at the program. Next slide, please. Who determines reasonably safe for services to resume, as agencies and parents may disagree? So our hope would be that this would be a team decision, that their family and workers, service coordinator, folks who are most closely involved with the individual and their supports and their needs should be a part of this discussion if at all possible, and there should be an effort to reach consensus. We offered, as Claire mentioned earlier, we offered some tools which are based on the CDC and Vermont Department of Health guidance around COVID-19 protections, safety, risk factors, and being in the community, safe practices to help with decisions about resuming services. You can see the links here. One is about returning to community activities, and the other is about returning to employment supports. We actually know that there are quite a number of folks who have successfully and safely returned to their job sites with workers supporting them. The agencies can make decisions regarding safety for their staff, because of course that has to be considered along with safety for the person who receives services. And individuals and guardians can make a decision about whether or not to participate in services. Next slide, please. Is the state looking at giving more than $5,000 for the future, as this amount is barely covering the expenses related to my not being able to work so I can care for my loved one? So these difficulty of care payments are really not intended to be income replacement for caregivers. This is, the source of these funds is Medicaid, and Medicaid is intended as funds for providing services for individuals with disabilities. These are payments to family caregivers for providing extra care for their family members who have a developmental disability because there's a loss of paid services during this state of emergency. And as Claire mentioned before, once we have confirmation of our budget for the entire fiscal year, we will look at what additional payments might be able to be offered, and we will rework things and go back to the drawing board and get back to folks with more information. Next, please. Thank you. What will happen after September 30th? Dale will make decisions about what will be available after the state budget is finalized. The one-time funds available under option 3 will remain available until they're all given out by the agency. So a one-time fund allocation is given at the end of every fiscal year to every agency. And the agency makes decisions throughout the course of the year about the distribution of those funds. And so they are utilized until they run out. Next slide, please. What is happening with funding from agency managed services when services are not being delivered? So through the month of August, agencies were authorized by the state to utilize those funds to continue to pay workers so that they could maintain their workforce. If they were to let go of workers, it would be incredibly challenging to bring people back on quickly to restart services. So many staff were kept on and were temporarily redeployed to other tasks or to other individuals being served by the agency if there were folks they were working with who could not participate safely in services. So starting in September, this is the change, that if services are not being provided, the agencies have been directed to stop billing for those services as was required. So services will need to be suspended for individuals if those services are not being delivered and the agencies will not be able to bill for them. If the services and billing are suspended for a portion of the specified time period, can the family caregiver receive a stipend? That would really depend upon whether or not there were unused funds from when the budget was not suspended. So when the person was receiving services or authorized to receive services, if there were unused funds, if there were services that couldn't be delivered during that time period, it might be an option, but not while the budget is suspended. Next slide, please. How does it work for people who have a unified services plan? So there are a number of individuals who are under the age of 21 because they have children's personal care, which is a service through the health department for folks up to the age of 21, or the high-tech program. This is for people who qualify, children and adults who qualify for high-tech, and those funds may be blended into a home and community-based services package. So the options, any folks who have that unified services plan with either of those two services or both of those two services wrapped into their budget, the options follow the guidance for HCBS, for home and community-based services, as we have been discussing. A family can decide to go back to separate funding streams to break apart their unified service plan, but the decision to do that cannot be done retroactively, only going forward, and the family would need to work with their case manager and with the Department of Health to follow the procedures for reinstating. And that might include a new assessment for children's personal care and or for high-tech nursing services. So it's possible, but it involves a good bit of work. And if at a later date the family wished to return to having a unified service plan, they would have to submit a new request to do that. Next, please. Will you be allowing caregivers to use waiver money to reimburse for loss of personal care services due to COVID-19? So just to make sure folks understand that when we read this, we think that whoever asked this question is referring to Children's Personal Care Services, which is a Department of Health program. If you have a unified service plan that incorporates your children's personal care allocation into your home and community-based services budget, that's what we're talking about here. So the funds available for payments to family caregivers is related to developmental disability services, HCBS, that were not able to be delivered, and not from other programs. Next, please. Will DDSD consider changes to the policy of not paying parents for the long term? So I believe that Selena Hickman, our director, has discussed this with a number of folks, and it was, I think, brought up previously at a previous conversation. Our leadership, we're committed to revisiting this topic with all the stakeholders, including parents, families, individuals who get services, and guardians who are not parents as well. It's a very complex issue with lots of different perspectives. Right now, as we have talked about, our energies in our department and our division are entirely directed on addressing the impact of the pandemic, and focused on the state of emergency, which has necessitated us working on many different, different alterations to policies, not only this alteration, this temporary alteration. So we will get back to this discussion with everyone. We have committed to that, but we cannot address it at this time. Next, please. Okay, here are our resources, but let's see, we have a little bit of time left. So let's see if there are some questions that were not answered that are in the chat function.
So Amy, what I'll do is I will run through all of them. I won't edit. So if you've determined you've answered it, we'll go by.
Okay.
So a set amount of dollars that can be converted. Last fiscal year was capped at $5,000 for one-time fund.
Yes, so that has not changed. The maximum again is the 1/4 of the individual's total budget that are self and family managed, or a maximum of $5,000, whichever is less.
Okay, my son turned 21 in July. Is he eligible for this program?
If your son is receiving home and community-based services and has a budget with funds that are some funds that are self and family managed, such as respite supports or in-home supervised living supports or community supports, yes, they could be eligible for it.
Okay. Can a family move some services that have been agency managed to family managed in order to get to the place where $20,000 is family managed in order to be able to access the full $5,000 in the quarter?
That's a bit of a complicated question. A simple answer is yes, money can be moved based on the individual's needs within the person's budget. That certainly should be a discussion with the agency, between the agency, the service coordinator, and the family as to what is going to best address the person's needs, and what are the risk factors for the person in terms of returning to paid supports that are being delivered by the agency, why they would not be able to access those. So I think it's a bit of a nuanced circumstance that would need involve discussion by the team.
Okay, if an individual lives part-time with an unpaid family caregiver and part-time with a shared living provider, is the family caregiver still eligible for this, assuming all other criteria is met?
I would think so. We may have to do a little more research on that one. It would depend upon how much respite was allocated for the family caregiver to access, and how much of the service package is being managed by the family, and how much of it is being managed by the agency. And if the person is living with a shared living provider part-time, that piece is, the contract for shared living is with the agency. So again, would require some nuanced discussion about what is needed for the person when they are with their shared living provider and when they are with their family caregiver.
Okay. It seems it is not really $5,000 or 1/4 of the total budget, but rather is 1/4 up to $5,000. Is that correct? That wording was a little misleading. If so, should clarify.
I think that sounds right. Selena, are you on here? Can you just clarify? Is that distinction correct?
Yes, I also heard it the same way as a restating of how we understand it.
Okay.
Thanks, Amy.
And thank you for that, for requesting that clarification.
Okay. Can a portion of a self-managed waiver that has no respite budget create and convert part of that waiver to a respite budget?
So I think that my answer is almost the same as the question about moving funds from
Right.
managed to self-managed. Again, it's a discussion, it's a team discussion about what is needed by the person and what are the circumstances in where they are living, and with their family caregiver and the risk factors. But monies can be moved within an individual's budget from one line item to another.
Okay.
Amy?
Yes.
This is Selena. If I could just additionally emphasize, as I believe Claire might have earlier and in the guidance, it is not an option to refuse reasonably available services when a person does not have a high risk status for COVID, and when the services are reasonably available. So it would not be possible for a family to refuse available services in that instance in order as a preference for the cash. But that's really an evaluation of the team understanding what the risk level is and if it is reasonably available.
So would that require medical documentation, Selena, then, as to the status of whether an individual is high risk?
I think that information should be known to the team already based on services to the individual that are being provided, and known information regarding the individual. We're really looking at the CDC guidance and Vermont Department of Health guidance as to who is high risk, and looking at health conditions and age, fairly common factors that are known there.
Okay. Does the disabled individual need to live with the parents in order to qualify for the flexible COVID-19 funds?
Yes, they do, and I believe we answered that question in the course of the presentation.
Okay. The payments are classified as difficulty of care payments. Oh, are these payments tax-free, tax-exempt payments to families? Will the income not account against other benefits the families may be receiving? So I think you did address that.
Yes, we did, to the best of our ability.
Okay. So someone's just saying, can you clarify? Option 1 will come from the budget. Option 2 does not come from the budget. and it's a crisis fund from the feds. So yeah, this is, I guess, a request for clarification. So is it that number one comes from the budget and number two does not come from the budget, but is in fact crisis funding?
Yes, so that number one, yes, is a conversion of funds that are within the person's budget already. Option two is are funds that would come from your provider agency, from your designated agency or your specialized service agency, based on whether they believe they can manage to make those payments, and they then would be requesting reimbursement from the federal coronavirus relief fund afterwards. And the reason that we are not making that a mandate for the agencies is that they will be able to request reimbursement, but there's no guarantee that they will receive it all. So I hope that clarifies.
Okay, I think this would be a note. Option two is not applicable to S&F management through transition two.
I'm sorry, can you say that again, Karen?
So it looks like it might be a note, maybe from transition two. Option two is not applicable to S&F management through transition two.
That's correct, yes. S&F would be referring to self and family management. And yes, so option two is not available for families who entirely self and family manage their budget and use transition two.
Ah, okay. And someone is asking, what is transition two?
Transition two is the intermediary organization that holds the budgets for individuals who self and or family manage their entire home and community-based services budget. And we'd be happy to send out contact information if somebody is seeking that.
Okay. Can you request funding from all three potential sources?
Selena, can you manage that one?
The answer is theoretically yes, you may. In some exceedingly difficult situations, that may be possible.
Thank you.
Someone was asking during the presentation, can we go back to the slide that asked how families will find out? So that might have been the slide, Amy, that you, right before the questions, but then I'm not really sure what the question was. There was a slide right before the questions about information.
How will the families?
Yeah, okay, yeah, how will the families, I think we went by it again. Next one. Yeah.
Oh, okay.
That was it.
I'm sorry. Sure. So yes. So this presentation, this webinar is going to be posted on the Dale website and on the Vermont Family Network website, along with answers to these questions. Agencies will reach out to families receiving services to explain the options, including translation or accommodation services if needed. And Dale will be sharing the information through its stakeholder networks. So that's, and families, of course, are always welcome to contact us at the division with questions, or if there are things that are unanswered or they're confused about, or to go to your service coordinator at your agency to ask them for guidance and support in sorting this out.
Okay. For any family that self-manages services and has an annual budget in excess of $20,000, but is continuing to not have home health care workers into their homes due to the increased risk of infection, potentially thousands of dollars of approved funding is not being used. This occurred in the fourth quarter of the last fiscal year and will occur again in the current quarter. What happens to these funds? Are they forfeited from the individual budget to the supervising designated agency, generally returned to the state, forfeited to Medicaid? If so, if to the agency, are there any restrictions on how the agency must use the funds? Are they obligated to use them to benefit the individual from whose budget they have been removed?
So we have not, budgets have not been, to our knowledge, reduced. We have not authorized agencies to reduce budgets for individuals. So as I believe we tried to explain in one or two of the slides, we were authorizing funds to continue to be paid to agencies so they could maintain their staff and provide staffing and supports for individuals who needed it. Agencies have been providing a great deal of supports through virtual means. There was an increased need for technology and have had, increased needs for lots of folks and for their agencies throughout this time period, through this emergency. So that if the dollars are being utilized by the agency, they're being utilized for the benefit of the specific individual or other individuals who are in need. But individual budgets have not been authorized to be reduced. I hope that answers the question. I know that it's a little bit confusing to think about, but I'm happy to have a conversation with the person if they want further clarification.
Okay, at this point, it looks like someone did want to ask a question live. Janice, do you want to unmute? Because I'm doing these in the order in which they came in, so it looks like the person might have unmuted, raised their hand at that point. Let me see. Wait, Janice, are you unable to unmute that individual? Okay, you are unmuted. Please go ahead and ask your question.
Thank you. Back to the parents not getting any type of the stipend if the individual needing the supports does not come to live with them. What if the individual was 5 months into their ISA goal of having their own apartment and was receiving services, then COVID happened. The agency did not provide virtual visits, but the parent did. The parent provided daily virtual visits. They lived in another state. And so a long story short, now the parent is with the individual that has the services via a local agency. Is there a workaround for that parent to get some sort of stipend for the hours and things that were provided?
As we explained, as Claire explained, there's a federal rule about difficulty of care stipends being provided only to individuals who are living with and giving care to a person in their home. So if the person is now living with their family caregiver who is providing that care and support, then they absolutely would qualify. But for the period of time where they were not, I believe they would not qualify.
Okay, thank you.
Amy, all I would add to that is that's related to options one and two, which are difficulty of care stipends, and the third option of the use of one-time funds. Looking at that criteria, it's a little bit different than the difficulty of care stipend. So it's possible use of one-time funds could also be an option in that instance. But that's a conversation, once again, with the agency and kind of looking at the unique circumstances of that family and individual.
Thank you. If a family is self-managing and the support worker is available, but the family chooses not to use them, can they still get the stipend?
I think we've been trying to talk about that, that it needs to be a discussion between the family and the agency. It's a combination of the workers being available and the person's risk factors for going out into the community, or for the worker coming into the home. But if the person's does not present a high risk for infection and has access to support workers to support them in a safe way, then they cannot, they would not be eligible for this.
Say that the state cannot approve payment of family caregivers on an ongoing basis, but this is in fact a policy decision by the state. Many families are suffering now, and sometimes even during emergencies, multiple issues have to be dealt with simultaneously. Many families who self-manage their loved ones are suffering now. Why can't the state temporarily approve this change during the pendency of the emergency and then defer to a later date the decision of whether to make this result permanent?
Since Selena is with us, I wonder if you could tackle that one, Selena.
Hi, sure, I'm happy to do that. And then Karen, I might turn it back to you looking at the time, since I think we are running over the time scheduled for the event. But we understand that this is a topic of great concern to many individuals. And that's certainly why we included it in the question and answer part of the webinar that we already went through. There are some states that do authorize this in a policy way in a long-term basis. Vermont currently has an emergency waiver from the feds related to the coronavirus state of emergency that has been declared by the state and by the federal government. So that is our time-limited authority for making these difficulty of care stipends in relation to the pandemic. But this exact question just received during this webinar, received by this individual and others, is why we have committed to have the conversation in a robust way as to what the long-term policies of the state should be. Really the problem right now is just capacity. All of our energy is on managing our response to the coronavirus, which is 5 months in, is still incredibly tumultuous. There are a lot of unknowns going into the fall and winter. We're constantly having to update our policies and rework how we work with the agencies and support individuals. So unfortunately, although we hear the urgency from families, we really are only able to focus on the short-term policies at this time, while we remain committed to a longer-term examination of where the state should go in the future.
Thank you, Selena. It looks like there are 3 more questions here, so I think we can probably zip through them. Would a caregiver be able to access more than just one of the 3 options? So this is actually a question before, meaning could a consumer qualify for more than one of them? So I think you did answer that. And they just did ask for option 3, is there a maximum amount of funds for that?
Yes, so the one-time funding, if folks want to take a look at our system of care plan, the maximum allocation per individual on an annual basis for one-time funding is $5,000.
Okay. If you were to receive services and have not, and the agency has not hired anyone, as we were in transition from high school, where would all the funds have gone?
Good question. If the person was, if their request for services, since they were graduating, if there was a request for long-term services that came to our equity committee and to the division, and they were allocated a budget for HCBS, for home community-based services, then that budget exists. And the agencies are working very hard to try to hire staff now, or to redeploy staff who left and came and now have come back, and to find the right level of support for for individuals who are entering services. We do know that and imagine it's been pretty challenging for families with kids who exited high school who haven't gotten their supports up to speed yet. But hopefully things will be moving along in the next month or two.
Okay, so if the presenters are okay, I'll read like the last two. And I think because there's a third one, looks like a repetition though. If a family chose to take their adult child home from a group home, would the family qualify for support even though typically in a group home?
Yes, if the person is living at home with their family and the family is providing support for them that would have been provided by the group home staff, then yes, absolutely.
Okay, will there be similar guidance regarding getting stipends for home providers or conversion of provider managed funds to a stipend?
Yes, that's another a talk for another day, but yes, absolutely.
Okay, so we are pretty much, well, it looks like there are a couple more coming in, but what we'll do is we will perhaps send them to you, to the panelists, and I believe you said you would do a document at the end of all of this with all of these answers. So yeah, I can see a few more trickling in, so we'll make sure you get to them since we do have to wrap up. So as we are wrapping up, we're just showing a couple of items about our virtual events. We are having, and this we as in Vermont Family Network, have a series of parent focus groups to provide input into the Developmental Disabilities Council's next 5-year plan. And we are also offering a free online learning series with the support of our sponsors, sort of in lieu of our annual conference. We will be putting out those details on our social media. Next. Just would like to remind families that we have the medically necessary supplemental funds that we administer with our partners at Children with Special Health Needs. Joanne is our point of contact, so call her or email her if you have any questions. And finally, thank you to our presenters who actually don't resemble the cows in the slide, and everyone for joining us today. An evaluation is going to pop up once we end this webinar, and it will also be sent to you in a follow-up email. We'd appreciate it if you would take a few minutes to give us your feedback. So we are here to help. You may contact us as shown here. So thank you again to all the presenters, and everyone have a great day.
Thank you, Karen. Thank you, everybody. Much appreciated.